Miracles do happen, and here's my story. When I was a young attending, first starting out as a neurosurgeon, I had a very young woman who came in with a ruptured aneurysm. And a ruptured aneurysm is like a ballooning off a blood vessel, and it can bleed and cause a lot of bleeding around the brain. And she came in a coma. And you have to realize people who rupture aneurysms, 50% of the people end up dying, and 15% of people don't even make it to the hospital. They die at home. And then if you do survive a ruptured aneurysm, about 50% of those people will have some permanent neurologic deficit. So it's a horrible problem to have. So this young woman presented in a coma. Her family came in, her parents, and I had discussed it with them. She was in a coma. Looks like she had brain damage. But without surgery, there's a high risk of the aneurysm re-rupturing. And with that, you can end up dying. So I recommended surgical intervention. She needed to have a tube put into her brain to help drain fluid off temporarily. And then after talking with her parents, I took her to surgery the next day to clip the aneurysm. So I did a craniotomy, took bone off her skull to access the aneurysm that was on the bottom of her brain, and then put a surgical clip across the neck of that aneurysm to stop it from having a chance to bleed again. So the surgery doesn't cure the injury of the brain, but it stops the aneurysm from bleeding again. The young woman was taken obviously to the ICU, and she spent weeks in the intensive care unit in a coma with a breathing tube, and also with the tube in her fluid cavities, draining the fluid off. With time, I was able to get the tube out of her fluid cavities, and also the breathing tube was changed to a tracheostomy, and she ended up having a feeding tube, and she went to a nursing home. And obviously, this is a young person. It's devastating for the parents to see your child like this. I would see her, at a month, and then 3 months, and then 6 months. And each time I saw her, she would gradually improve. The first time I saw her, she started to open up her eyes a little bit, would look at me, maybe follow a few simple commands. And by 6 months, she was actually talking. Not perfect. You could tell things were not quite right, but she was talking and moving her arms and legs. And by a year, she came back to see me, and she was back to her job as a school teacher and was completely normal. I couldn't tell that anything had ever happened to her. And so this was a miracle in my mind. I mean, most people who rupture an aneurysm have some bad outcome, whether they die or they have some permanent neurologic deficit. And she made a completely normal recovery, went back to life as normal. And it's so interesting because probably 10 to 15 years after this, she came into my office for another problem. And she said that you probably don't remember me, but you operated on me when I was younger for ruptured aneurysm. And I want you to know